Welcome to Thrive by the Rising Muse, where we have real, honest, and powerful conversations about mental health, personal growth, and community healing.
Today's episode is one you do not want to miss. We'll be tackling an important topic that impacts so many lives: mental health, medication, and the stigma surrounding therapy, especially in communities of color and faith-based.
I'm Naty. I am Naty.
I am Veda.
And we are here to thrive.
Yes, we are. Welcome to Thrive by the Rising Muse. Today we have an amazing guest to help us navigate the conversation of mental health and the stigmas around mental health. Dr. Ronda Hampton is highly respected clinical psychologist based in California. She is the co-founder of Reach for Mental Health Awareness, a nonprofit that assists families searching for missing loved ones. I love that. While also working to spread awareness about mental health. You may also know her as a strong advocate for spread awareness about mental health.
She's a strong advocate for justice for the cases of Latrice Richardson, a young woman that went missing in 2009. And beyond her clinical work, she is also the co-producer of The Lost Compassion, the Latrice Richardson story. That's an award-winning documentary, and the author of Amber Goes Missing, a book aimed at educating children about personal safety. Dr. Hampton, we are so honored to have you. Your work has touched many lives, and we welcome you to the show.
Thank you so much.
So let's start with your journey. What made you become a psychologist, and how has your advocacy work evolved with time?
Okay, so here's the thing. I grew up here. I grew up in Southern California, and I was probably about 8 years old during the Watergate trials, and I lived right across the street from the school. And so one of the things I would do is I would run home as quick as I can to watch anything on the news about the Watergate trial, and just was totally fascinated. Well, so one day I run home, and it's a Friday, and there was nothing on the news, and there was no trial news going on, and I was freaking out and asking my mom what's going on. And so she says, "Oh no, they're in a recess." Now, recess to me means playing at the jungle gym. So I'm like,
right.
So she explained that to me, and I was really not happy about that. But I sat down, plopped in front of the television, and on the television was this program, or was a movie actually, about this young woman, and it's taking her through high school, college, and eventually getting into grad school and becoming a psychologist. And the story ultimately was a relationship story, but I was hooked on the work that this woman was actually doing. And it was at that moment, I remember after that show was over, I told my mom, and I was like, that's what I'm going to do. I'm going to be a psychologist. So, that is really it. That's what sort of opened my eyes to the field of psychology, and just the educational component of that. Just
awesome,
learning about the brain, and
not too many children run home to watch basically the news,
right?
Or things dealing with the White House and stuff.
Right.
Do that. Yeah.
Now, in her case, all I was thinking is like she might like crime shows like I do. Because I didn't enter in behavioral health for that. I just trying to figure myself out. But and I wanted to help people, and I think my dream was to help people. My first thing was I wanted to be a doctor. I didn't make it there, but I wanted to be a doctor. What I wanted to be was a pediatrician. But when I heard in medical school you have to open a dead body, I said, we're going to have to figure the doctor thing some other way. And I figured psychology, I could still help and not have to open a dead body.
I wanted to be a dancer on Soul Train.
I'm sorry.
I did. Every Saturday, Soul Train. Folding clothes and Stuff. I wanted to be a dancer on Soul Train, not a doctor. Okay. Dr. Ronda, mental health stigma in the community of color and faith, we still got a ways to go. Okay. We have come far, but we're not there yet. And we still have significant barriers to seeking help. What do you think contributes to the stigma, and how can we work to break it down?
Okay, so I mean, this question is. I have a lot of thoughts about this question. Just generally speaking, when we talk about stigma, and honestly, it comes down to the field of psychology and psychiatry. To me, that's the bottom line, and I'll tell you why. Is that when Freud and his boys, got together and decided like there's going to be this thing called talk therapy, they weren't thinking about people of color, and they
Right.
weren't thinking about people who couldn't afford their services. So
Right.
much of what we know about helping people and about mental disorders comes from the perspective of the founding fathers, if you will, in the field of psychology, and they just we weren't included in that. Not to
Right.
mention is that historically, just even during periods of enslavement, it was the belief that Black folks, anyways, could not suffer mental illness. And the reason why they couldn't suffer mental illness is because we didn't have any of the stressors on us that might contribute to a mental health issue. So we have a system that does not believe that folks of color have mental illness anyway. And then the treatment that's there is based on sort of like white middle class value systems, right?
Right.
So that even if somehow somebody made it to, a mental health clinic, they're not necessarily going to get the appropriate care. So when we talk about the stigma, in my opinion, we need to redefine the problem as the problem being with the field of mental health and not about the communities, right? So oftentimes, like even encouraging people to go get mental health services back in the day might mean that you're going to be misdiagnosed, underdiagnosed, or sent away to begin with. So it wasn't a safe place for people to be. And so the only option that there really was family, friends, and then, religious leaders. So it makes sense that they would go to the religious leaders. Some of the issues with that was, people somehow walked away from that feeling like, well, if my faith was stronger, or, if I only prayed hard enough, then maybe I would feel better. So that's kind of like, the intersection of, sort of the rejection of treating folks of color and, religious underpinning. So I just really, it's easy. The easy answer would be say, let's educate the churches, or let's educate people about, mental illness in our communities. Exactly. I'm not even sure to this day that I would send clients to particular therapists, even as we speak in this day and age. So I just think it's complicated, and I think it starts with the field of psychology making the decision that we're going to do this differently.
Right, and that's one of the things that it's a pet peeve for me. It's the issue of people, especially in the faith community, thinking you just have to pray more. You're just not having enough faith. I mean, I'm a believer and I'm an apostle, and I think that I have all the faith, and I know God wants and can, in a second, heal me. But He had, the word even says, in the world you will have trouble. So trauma is, and circumstances and issues are part of the design. Proverbs said, without counsel, my people perish. So he, even in the word, it says you might need some help. So when people think that because you're struggling, you're not having enough faith, or you're not praying enough, I think they're missing some parts of the Bible that really tells us this is a broken world. We're not going to be walking on clouds, and we sometimes need help. We can't do everything on our own.
Right.
And just like there's people who are engineers and can build bridges and people who are architects that can build buildings and houses or whatever. There's people who have prepared themselves to be able to help other people. And those are, those of us who have decided to study the field. So I wish if I had my wish list of my 10 things, it would be that people would understand that there's nothing wrong with getting help and that we could break that barrier. Now, I know I'm thinking in 2025 mentality, but when you said that, even in enslavement, they couldn't have mental health issues, my first thought was like, yeah, being beaten all day wouldn't give anybody mental health issues.
I don't see it.
I don't see it, right?
Right.
Okay, that sounds interesting. No, but it's true. They didn't think of slaves as humans. So I get what their point of view is, but again, I'm thinking from this other side. It's like, couldn't you see that the fact that you were mistreating them, that they barely had to eat, they had to work a number of hours, that would not stress anybody.
Well, you know how people justify
absolutely.
what they do
Absolutely.
and why they do what they
Absolutely.
do. Oh.
Absolutely. This happens in 2025 in abusive relationships. So, yeah, I can see that. It's just my brain.
Even historically, for those psychologists back in the day who actually believed, maybe these, slaves can have mental health issues, the treatment was beating them. So if we could whip it out of them, then maybe they would get better. So this is the reason why families began to protect one another. Like, don't talk your business out there, because if you do, you might get harmed, right?
Yes.
Right. And I, in my own practice, one of the things that I do, and when I say it's going to be incumbent upon us in the mental health field, I establish relationships, and I have very established relationships with local religious leaders in my own community. So. So that, if you refer somebody to me, or even if that's the church that you go to, I know even at, when I'm at mass, there are many of my clients who are sitting amongst me. So it's like, how do we, as individual therapists, how do we reach out to the religious leaders in our community to say, I am a safe space. This is a place where you can see your clients, and let's talk about it. Let's work together. And I've been fortunate enough to be well received, at least in the area, that I live in. And I just challenge a lot of psychologists to go out and do that. Because I think it would be, one by one, we could kind of change this attitude,
about we call the cell process. One divides into two and two into four. Yeah, absolutely.
Exactly. To do it.
So tell us about your organization Reach for Mental Health Awareness. Tell us all about that.
So, I was about 45, living my American dream, to become a psychologist, and I was married, and I had a kid, and I was doing all the things. And I had an intern, Trace Richardson. And so she was with me for about a year. And then upon her graduation from college and everything, she was kind of out in the world, and she was out at a restaurant and suffered a mental health event. And this was in Malibu. So she was out in Malibu and, mentally compromised. And the police who showed up at a restaurant that she was at, instead of taking her to get a mental health evaluation, they had her put all her belongings in their car, and they drove her up to a jail in Calabasas. So it's about, 15 miles up the canyon. And ultimately they released her at about 12:28 a.m. I don't know if you're familiar with Malibu, but so Malibu is the beach area. You drive through the canyon.
Yeah, much
through the canyon is this, police station, which essentially is in the middle of nowhere. So she was released with no car, no phone, because all of her belongings were left in her car, and she was released at 12:28 in the middle of the night. And so her mother called me and said, "Had you heard from her?" And I remember the moment her mother asked me if I would reach out to law enforcement, which I was very afraid, because I was living my American dream. I was, doing all the things, and I hadn't had interactions with law enforcement like that. But I made the phone call, and it became clear very quickly that they were not going to search for her. And from there, it just was, that sort of started my advocacy work. Unfortunately, her remains were found about a year later, through much debate with law enforcement, like, why would you release somebody in the middle of the night, that way? And unfortunately, she was discovered after after she was found, I co-founded the Reach for Mental Health Awareness with my partner who lives up in Northern California, because one of the things that was realized is there's not help for people of color to begin with and those with mental illness.
Right.
The searching is different. There's just a different set of skills that need to happen. So the things that I learned along the way in searching for my trees are what led to the organization. And so I have volunteers that help when we know that someone's been missing, or when it's brought to our attention that someone's missing and they have a mental health issue. We will, advocate with and by the side of the family, making sure that we interact with law enforcement when we have to, and just making sure that all of their needs are met. So it's very rewarding work. I do have to say that.
Yes.
I'm happy that you're doing that, because one of the things that I see, I'm an avid crime show type person, more reality. I watch court proceedings and stuff like that. Not, I mean, yeah, I might watch Law and Order and stuff, but I like the real stuff. And one of the things that I noticed I was just thinking as you were talking about the case of Gabby Petito, one of the things that came out was how all these resources were placed for a Caucasian person. And then there was all this list of people of color that had been missing, and there was no TV.
Yeah.
The good thing that has come out that is, I believe her parents have made an organization that's trying to give publicity to everybody,
Yeah.
not just a certain part of the population. But it is true that, and I mean, from my experience of things I watch and research, that unless the family is on top of the police, even if they're Caucasian, on top of the police, if you have somebody with mental health, or we have somebody with, like, they're homeless or they're in prostitution, they don't realize that that's a person too.
Exactly.
Even if they have a high risk lifestyle, and unless the family is there insisting with the police, even being able to invest resources that they don't have to hire investigators or stuff like that, those cases go by the wayside.
Exactly.
So I'm very glad for the work you're doing, because it is very necessary, and I hope this motivates other people in other areas of the country to do similar things.
Well, the way I've become to look at this is, your kidneys are bad, you go to the doctor.
Right.
Or to the hospital. Your liver's bad, you go to the doctor or the hospital. You're hurting, whatever, you go and you tell them what's wrong because you want the pain to go away.
Right.
Well, the brain is also an organ.
Yes.
And we shouldn't be ashamed, because that organ is not,
it's malfunctioning,
functioning like it should be.
Right.
And I guess for us, I grew up in a neighborhood of shame. Born in 1963, Dad went to Vietnam, went to Germany, came back. Same body, different mindset. Okay? He never talked about what happened to him, but Mom said that he would wake up screaming in the middle of the night in a cold sweat. And when she would, try to talk to him or get him to talk, he never opened up about what he experienced. And I'm very sorry that our men were not taken care of when they got back.
We still have some issues in that area.
We got issues in that area.
Yeah.
But one of the reasons why I wanted to go into behavioral health, because I needed to understand why people act the way they do. That was it. I needed to know why things happen to me as in my life, and why people acted certain ways and secretive and all this stuff. And, secrets can cause death. They can cause death. I've seen that in my own family. But I am a believer. If medication is needed under the doctor's care, okay, let's do this. Let's try.
Which brings us to a topic that we wanted to bring about. And it is, there's several methods of mental health treatment.
Mm-hmm.
Not everybody is on ECT, which is not like it used to be, or like a fly over the cuckoo's nest type thing anymore.
Yeah.
We don't put people in padded rooms, so that's movie stuff. And not everybody needs medication.
Right.
But some people do.
Yes.
As a psychologist, when would you recommend somebody to start going to, or refer somebody to a psychiatrist to consider medication aside from therapy?
And we know that everybody's different.
Oh, of course, we're talking like ballpark.
Well, okay, so first of all, I mean, in my practice, because I do specialize in chronic mental health, issues, so that would, schizophrenia, bipolar disorder, chronic depression, that's my specialty. And I spent the the beginning part of my career working in acute hospital settings, long-term hospital settings, before I started my private practice. And I continue to do the work of working with,
So basically, all your clients need medication.
Well, no, and they
see, those are chronic illnesses.
However, although my private practice, I would say probably about 60% of my clients would have like chronic mental health issues. The other is like, I'll do some couples work here and there, or some court order work.
Gotcha.
That. So, but I will say this: when a person walks into my office, they're an individual, and so. There's not, while I have lots of tools under my belt, but the most important thing is when that person sits down, I don't care how they got to me or what the previous diagnosis is, I'm going to start from scratch. What is going on with you? So I think that, it takes getting to know the person, understanding what they're going to, understanding their history. Sometimes people come in and they don't need medication. Maybe they're having a reaction because, there was a death in the family and they're having depression. And even if the depression is going on longer than what we might think, my first line of treatment might be, are you, what are you eating? What are you putting into your body? Are you moving at all? Who's your support system? Let's try to see if we can get those things in place, and I may work a couple of weeks with the person on that. And then maybe they start to get better and they don't need medication. After a couple of weeks, if they're still not able to get out the bed, if they're still not, enjoying life, if they're at risk of losing their family, losing their job because of their condition, I'm going to consider medication. Now, I'm a psychologist, so I normally am going to do psychological testing. That's a blessing that I am able to do that. So, I usually will do comprehensive testing to see, let's see what's going on. But sometimes medication is necessary. So for me, it's really getting to know that person, to understand their symptoms, to see how they've managed the symptoms over the years, what kind of treatment they've gotten in the past. Have they been on medications in the past? It's just not a one size fits all treatment, at least not for me. So everybody is different when they walk in that door. I think that's why I've never been burnt out before either.
Cool. I heard a comment, and I know the answer, but I still want to put it out there. Some people think that a person who takes medication is not facing their problems or their trauma, and they're hiding their pain behind medication. Is that accurate when people are active in their treatment?
So if we're talking specifically about medication.
Oh, psych medication. We're not talking about drugs.
If we are talking about antidepressant medication or psych medication, if they are on psychiatric medications, that means that a psychiatrist who is qualified has heard them, listened to their symptoms, prescribed the medications, maybe even made adjustments to the best they can. Hopefully they've referred them also to some type of therapist, so that, that's the best form of treatment, a combination of medication management, and psychotherapy. So hopefully that is what has happened, because what we do know is that some individuals may be born where their body is just kind of dysregulated with regards to, certain neurotransmitters running through their brain. And if that if that combination of a predisposition towards depression and some kind of like event that has caused that person may need medication just because their brain is dysregulated. And what happens is you give them the medication, and if they came in there for an event, now they can face that event. Now they can address those issues. And now they can begin to include things in their life to assist them in dealing with their trauma, their depression, their mental health issues in a more holistic manner.
SSRI addictive. I'm sorry. Well, I'm see, we're having this conversation because right now, let's face it, there's the conversation about how antidepressants work on people, and there's some consideration about removing the medication from people. Personally, and I don't care if I get attacked for this, I don't think this is a good idea.
I don't either.
For many reasons.
I definitely don't.
I know you can have more expertise than I do, but I've been in the mental health field since 1999. I can tell you, I'm not going to say it's a joke because it's not funny, but it's funny now, 20 years later. I used to work at a place. In that place, one of the responsibilities was to approve medication for Medicaid patients. And this wife her husband had schizophrenia. I was not in charge of medication, so it's not my fault. But the pharmacy department, for some reason, decided not to approve the medications. And he was without medications for over a week. The lady brought the guy to our offices and said, if you're not approving the medication, you can handle it. And I laughed, but it's not funny because I can only imagine what she was experiencing. Mm-hmm. It's funny for me in the sense of how could you think that somebody with such a chronic disease is not going to need their medication when their doctor said they did. Right. So I'm laughing at the administration that didn't approve it, not at the lady.
Right.
So with with that frame of mind, and like I said, not thinking that it's wise to remove people who professionals have told them that they are better with medication, people who have proven that their lives have improved with medication. How do we consider this thought pattern that SSRIs are addictive, or that people should do other activities instead of taking their medication?
And I think that's another issue that comes down to our mental health field. Because
yes.
Quite frankly, there are mental health professionals who will say that they don't believe in medication, which is absolutely ludicrous to me, especially in consideration of the DSM-5, our current diagnostic manual.
Yes.
Literally, I'm
dumbfounded. I haven't found one of those, so thank God. Okay, go ahead.
But that supports the fact that, like, some people need medication. The big issue is it addictive or not? And so, no, it is not addictive. Mm-hmm. And anybody who is in this field, you don't expect lay people to necessarily know that. They rely on us professionals
Right.
Stay on top of the research, to put information out there that is accurate to the current research in our field. And I say current research in our field because, like, the current medications, we're talking about second generations antidepressants right now.
Right.
But also there's current research that is working on even, different types of medications. The brain is fascinating. The brain is complicated. Yes. We're always learning something about it. Years ago, there weren't even SSRIs, to even talk about. So people were in sanitariums and they were in boarding care facilities and they couldn't live a normal life, right? Now we do have, and those are people who are suffering, recurrent, depressive episodes. Now with SSRIs and SNRIs and MAOs and other, antidepressant medications, now people can live whole lives. These medications are not addictive. And the research clearly spells that out. Addiction, by definition, or at least by the understanding in our field, and I know you already know this, is this person taking a substance that they are craving, that they built tolerance for, that they will interfere with their occupational and social functioning in order to get that drug, and they need more and more and more to get the high. Now, so I have not seen a drug dealer standing on the corner trying to sell some Paxil. That doesn't happen.
Yeah,
And
well,
what
I
I've
was say when I say Paxil, that's what I thought too.
Or
Or Solove or Wellbutrin.
Zoloft
Yes.
or any
Mhm.
so and people are not who are taking these medications are not going around saying I need more of that, I need more of that. They're going to their doctor's prescribing it, they're getting the amount that is helpful to them, and they're taking
Right.
that. So what's happening though is that because there could be a discontinuation effect, of taking some antidepressants, people are now saying, see, now that person is withdrawal. That is so inaccurate. So inaccurate. And there are those who are saying that we're playing with semantics by I won't use the word withdrawal when I'm talking about antidepressants. So if the person has what we call antidepressant discontinuation syndrome, I am recognizing this. It is time for them to come off the drug, and we can taper down and go really slowly and see and monitor them. By the way, when my clients are coming off their medication, you know what I do? I increase their outpatient therapy. So they're going to see me even more
Some support.
yeah, because here's the thing. We have to distinguish between antidepressant discontinuation syndrome and relapse. So is it that the person is
Yes.
actually relapsing and it's just not time for them to go off, of the medication? And the symptoms are this is an entirely different set of circumstances as compared to like heroin withdrawal. So for JFK to actually publicly go out and say that it was worse for him coming off of heroin and than I guess him or family members coming off of antidepressants. First of all, how do you even know? What year was that happening? Were you taking both? Were you on antidepressants yourself? So
I was going to say, was he even in antidepressants? Because I think he's saying he was coming off of heroin, not antidepressants.
And last I heard, heroin is not an antidepressant.
They don't prescribe heroin, as far as I know. The last time I checked.
Look,
thank you,
doctor.
And heroin withdrawal is very serious. When I worked in the
absolutely, it could be deadly.
Hospital, and we would have to they would come to the psychiatric hospital and we would care for them while they were going through those withdrawals, which look entirely different than antidepressant discontinuation syndrome. Okay. And we professionals have to use precise words. We can't play around with that word, because in that stigma, people who otherwise would be on medication are going to be fearful that they're going to be addicted, which they won't be, and be fearful that if they try to come off the medication that they're going to have, classic opiate withdrawal syndromes. It is our job to make sure that these individuals are informed, at least informed in a way that is consistent with current research and not based on our personal bias.
Right.
That's true.
Especially because, like you were saying, two people can react to the same medication in a different way. And there's two things that it came to mind. One was sometimes and I like the way you said it, the discontinuation symptoms. It's not just because the person might be coming off. Sometimes a medication stops working, but you can't totally pull the person out, so you have to discontinue for a while so then you can introduce the new one.
Yes.
I can tell you, I don't care. I am on a particular medication that at the beginning I was allergic to, but the effects were the other antidepressants didn't work, and she was like, "But you have to stop that," because it was not hives, but it was like a weird sensation. I was like, "But the other stuff doesn't work." Somehow, it was apparently my body needed to adjust to it. Like a month after that effect went away. I've been on it for over 10 years and I'm fine. So, sometimes just because your body reacts in a certain way doesn't mean that it's messing you up. It doesn't mean that you're addicted to the medication. It doesn't mean that it's not working for you, because that's the other thing that sometimes people don't realize. Antidepressants and antipsychotic and all psych medications are not like Tylenol. You cannot take 2 aspirin and in 2 hours you're gonna don't have the headache or whatever pain in your body. It takes 2 to 4 weeks for your body to adjust, for you to start seeing some of the effects and start seeing some recovery. And sometimes at the beginning, when you're adjusting, like you said, you even need more support and more counseling and more vigilance because we have to make sure that you're okay, that it's not going the wrong way. But, and it's a process. It's a process. It's, even though we do say, and I I believe this wholeheartedly, that the brain is an organ, but it works differently.
It does.
And so for me to think that it pains me because mental health issues are pain. Just like, again, diabetes or cancer or whatever, it's pain. It's just mental pain, and it's the inability. You're fighting yourself because your thoughts are confused, or if it's depression or anxiety, your system feels an attack that is not there, and it's not that you're losing your mind. It's the anxiety, and a lot of people who are not seeking help because because they have the wrong misconception. And you say something, and that just came to mind. How in the same profession we don't sometimes understand the depth of it. Yes. And it reminded me of what happened last week. I worked with someone for many years, and they are a behavioral professional. Mm-hmm. I know they were a licensed clinician, and they had a child with disabilities, and they got laid off. And I don't think they went for help because they took themselves out. Oh. And left the family and left people that loved them. Mm-hmm. And I was so shocked because it's one of those things. This would have been the last person I would have thought, because they had a bubbly personality. They were very positive. They were very kind. And that was the last thing I would have thought it was going to happen. And this was a mental health professional. That is just... So, when somebody is going through those type of struggles, if you have somebody in there, you could have all the education in the world. If you don't have support, and you have somebody in your ear saying, you need to buck up and forget about it. Right. You grow up and grow a set or something. And, you don't need medication. You just need to go exercise it and wear yourself out. Yeah. You might not be saving a life. Wow. And there's so many people, like you were saying, like, 50, years ago, all these people were probably in an asylum, and now they are people who are working, mm-hmm. who are tending to their families, who are living productive lives. How are you going to go back into this? Yeah. Part of what, and correct me if I'm wrong, part of what the laws that change, I think it was in the 90s, about what was the word? It was like doing the minimum necessary, a restriction necessary. Least restriction. I believe it was the way it was called. And it was precisely that, and that's one of the reasons why we don't have people 30 days in a hospital. We usually have them 5 or 7 days. If they stabilize, let's try to reintegrate them to the community and to their life with support and stuff. Because we, as you said, as research advances and technology advances and we learn new things, we learn that they thrive better in their environment than locked up in a place. Yeah. And people with old-fashioned ideas and lack of knowledge, who have not, I can't say they have not taken Psychology 101 because I don't know their resume, but they might have had an elective of Psychology 101. I don't know. You made it in Psychology 101? Right, so I probably did too. I can't remember my specific grade for Psychology 101, but I'm sure I did good. But I know their background is not in behavioral health at all. Can make decisions for things that they don't know. And I said, go ahead.
Doctor.
Yes.
I am the best version of Veda when I'm on my medication. Okay? Because when I wasn't on the right medication, I had some feelings come up in me that it's just not even my
And yours
personality.
was not like you were new. It was a transition.
It was a transition.
They were changing you. Yeah.
And my doctor tried new medication. Well, within 2 weeks, I knew it was the wrong medication because
I knew before because I was like, "Are you okay? Why are you barking at me all the time?"
I was a little snippy, okay? But my husband, 6'1", 3 plus, 100 pounds, I was getting ready to climb him like a tree. And I was going to beat him. I knew I wasn't going to win that fight, but he was going to know he had been in a fight. And I'm not even a violent person.
No, and I'm telling you, she is super laid back, super sweet. And we were talking, and I was like, "You're barking." Like, she was like, "Okay."
Didn't even realize it.
What's wrong with you?
And I went back to my doctor. Well, my daughter had to separate me from my husband.
I actually offered you to come here for a couple of days.
He's not violent, thank God. But he was like, something wrong. This is not my wife. Mm-hmm. Went back to my doctor, told her what happened. She did laugh and apologize for being unprofessional, but I said, hey, if it's funny, it's funny. Just give me the right medication.
Yeah.
She put me on the right medication. I have been fine ever since. Okay. And that's why I say I am the best Christian. I'm the best version of myself when I'm on my right medication.
I mean, all the things we do, like we were telling you, we do this podcast. We homeschool 3 kids. We have other side businesses that we're working on. Our days are crazy. Field, and that's a good one. But we are being able to be productive. So I like I said, it pains my heart. Not everybody needs medication. Not everybody needs counseling maybe, but not medication. Yeah. But whoever does need it, take it.
Well, so here's the sad part. I mean, and I appreciate that. We literally have to have this conversation is unfortunate. Yes. Because if you think of things like, let's think of like diabetes. I think you mentioned, let's think about diabetes.
Right.
Type 2 diabetes, which type 2 diabetes, a person may literally be dependent, not addicted, but dependent on insulin for that moment. But once they, if it's type 2, maybe when they get their eating under control, maybe when they lost, a certain amount of weight, the doctor can maybe then try to, titrate them down from the medication. Yeah. And by the way, there will be some kind of discontinuation effect when someone's titrating insulin because their body is not addicted, but dependent on that extra boost. And so, but if they can manage it on their own, working with their doctors, then they can do it. See, nobody would dare argue with a type 2 diabetic, saying, okay, maybe temporarily you need to be on insulin, or even maybe you need to be on it forever. No one's going to argue about that. But we are literally having a discussion about someone's brain that is dysregulated, and we know it. And we don't 100% know why, but we know that there's something biochemical going on in some of these cases. Right. We should not have to be arguing and defending people who are taking their medications so that they can have a better life. That's a damn shame.
It is. Yes. It is. It is. And this is why I wanted to have this conversation. Yes. Because I want everybody within the sound of my voice to hear this message. One, do the research, read. When people tell people, you go read a book, don't say that. They might read Dr. Seuss, and that's not what we're talking about. Don't tell them just read a book. Actually look for the information on this. Talk to actual professionals. I would not go to you to talk about chemistry maybe because your mama was a science teacher, but not about, biochemistry or even, engineering, because that's not your thing.
That's not my thing.
Right. And I don't know your gifts, but I wouldn't go to talk to you to carpentry or something like that. I'm here talking to you about mental health because that's your specialty. Yes. Right. So go, If you need to build a house, go to a carpenter. If you have issues with mental health, go to a professional
Exactly.
and listen to professionals. I think that the part that's frustrating me with the way the world is right now in general is that a lot of people in different areas are talking about things they don't know about. That professionals are being silenced, and and people who just have thoughts, and we all do, but that doesn't mean we know what we're talking about, right?
Mm-hmm.
So
and you can't play with people's lives,
and that's my issue.
cannot.
And that's why we have to have the conversation, because we can't play with people's lives. Trauma is serious, and we are living through traumatic times.
Yes.
If nothing else, we need more counseling and probably more medication. More people are going to have to need medication because they have all these kind of situations that are happening.
Mm-hmm.
You woke up this morning thinking that you had a job, and you don't have a job.
Exactly.
And it's not because of anything
you did.
Just the way it is.
I was reading something this morning that there's a particular state that is running out of money, and several farms are probably going to close. But that's traumatic. If this farm has been the legacy of your family for how many generations, and right now you're not only going to lose your livelihood, but the entire thing that your whole family has worked for, I would think that will feel a little blue, and that's going to affect you a little bit. I tend to be sarcastic. I'm sorry about that. So, it's logic, and my thing is not just from the authorities and the way we're thinking, but we are in a world where social media is so integrated in our DNA, and that's my frustration when I see other people. No, but you don't need to go to psychiatrist. You don't need to go to counseling. Could you sit down? You don't know this person from Eve or Adam. You don't know what's going on in their house just because you see them online. You don't know.
Exactly.
You don't know if they have some trauma that's not happening. You don't know. You probably need medication and you don't know it. So I'm sorry. So yeah, it's just.
It is a little, it's quite infuriating to me. And I want to
Yes.
piggyback on that, is that when you get these social media influencers who, when I come across them and I hear them, sort of anti-therapy, by the way, while they're touting themselves as therapists. So I think that's really interesting. Or anti-medications, and I'm like, okay, let me see what they're selling. So what they're doing is try to discourage people from going to get professional help, either through professional counseling or medication or whatever support groups. But when I follow them, I'm like, let me look and see what they're up to. It's like, oh, you're just trying to get these people to buy your book or to contribute to your platform, that your way. You're not even licensed or not even a mental health professional. Oftentimes they're coaches. Oftentimes they're like executive coaches and these are life coaches, and they're just trying to get people to go over to their platform and buy their book and buy their product and buy their program, and that this is going to be the cure all. Unbelievable. I do want to add a word about life coaching, though. I work very comprehensively with my clients, and I do work with some life coaches, meaning that my clients are better served with a life coach, maybe us working in collaboration. So I am not against life coaching at all, and sometimes we do sessions together. And
I'm a certified life coach. I'm not against them.
Yeah.
So I get it, and I still have this pet peeve because, like I said, I'm a counselor. I have a master's in counseling, but I'm also a certified life coach. Each thing has a purpose. Life coaching is just addressing a particular issue in progress and kind of setting goals. Where counseling is a bigger and deeper issue, and then psychology with the testing and stuff. Everything has its place. So yeah, I agree with you.
And what I do appreciate about life coaching, especially those who can stay in their own lane, is that sometimes they are the first people have less problem with going to a life coach. And so those well-trained and well-equipped life coaches know sometimes, listen, this is what I can do. You need to be referred to, to a mental health specialist. So I just wanted to establish it. There's a pretty well-known TikToker out there who is a life coach who, she infuriates me though. It's like, why are you telling these people not to, not to go to therapy or that their therapy is hindering them? How on earth are you doing this? And people are believing this nonsense.
Well, yeah, because if somebody, I didn't look at how many followers you have. I don't even have 5,000. I didn't look, so I don't know. But I know I don't even have 5,000. But because somebody has 100 million followers doesn't mean that they know what they're talking about.
It does not.
It just means that they can probably sell their message better.
They draw people.
Well, that's all it is. Because I know I'm not good at selling. But
I think too, those of us who are licensed, and this is why I think a lot of times we don't put ourselves out there in social media because we have a lot to lose. So going on my rant I mean, I didn't have a lot of followers. I was surprised about the amount of people who were actually, I think I had like maybe 300 followers. I mean, they're like, I was the person at the end of the evening. I would just go on TikTok and kind of scroll. It wasn't anything. But, I just got so upset about RFK and his little comments that I just went on my little rant and, and so, yes, people have been messaging me. And so that's been, it's actually been positive just to be able to make sure encourage people to continue to work with, to work with their therapists. I know I'm a tough therapist, so my clients don't get wiggle room with me. So it's like.
Sometimes reality therapy is what people need.
Yeah, definitely.
Tough love. I am that kind of person too.
I have a question, doctor. What happens if you abruptly stop taking your medicine? Okay.
Without supervision?
Without supervision, can there be consequences, ramifications, repercussions?
So that happens all the time. And y'all, we all do it. What happens when we get an infection? We go to the doctor, they give us an antibiotic.
Right.
We supposed to
take it 10 days. After day 5, we don't take no more.
Right.
Thank you. So we all do it. So when people are on medications and they start feeling good and they've been feeling good for a while, sometimes they just stop. They don't think about it. And, one day turns into 2 days, 2 days turns into 3 days. And then next thing you know, they may be having antidepressant discontinuation syndrome, where they're having some like flu-like symptoms when it's very, really serious, or they also could be relapsing and just medication. So yes, it definitely going off abruptly can cause some discomfort. It can be problematic. This is why you need to go off of that medication if you're ready to go off, with supervision. The same way, by the way, is when you're type 2 diabetic and it's time to be discontinued from your insulin, you don't just go off on your own. Your doctor has to help you through that. So I'm not denying that kind of discontinuation syndrome happened, because it does. And those symptoms can be very uncomfortable for people. I will be honest about this, and this could just be that I've been lucky, is I know that it happens, okay? I'm not saying that happen. I have never had a client who has had severe antidepressant discontinuation syndrome. And it may be that I have a pretty tight relationship with my clients. So even when they do go off, if I see you in like 3 weeks and you look kind of funny, we're going to talk about what you've been doing. So I know that it exists. I just have not seen it. I want to be clear that I know that there are people out there who have abruptly stopped their medication, and they may be suffering for months and even years, the effects of coming off that medication. I've just been very fortunate to not see that, but I do want to acknowledge that happens. And I would say that it's those people really need to get themselves back in working with, especially if you're talking 2 and 3 years out. We have to really know what's going on. It may not be just
the medication. It might be something else.
Right.
Yeah, and I make that statement based on research. So I'm a pretty. I try to stay current on research. I enjoy reading research. I love reading about the brain. I taught psychopharmacology and the biology of the brain for many years. So this is kind of my passion. So if a person's having it to that extent, I think they kind of need to go to get checked out to see if there might be something else going on that may be mimicked. But I don't know. go after medication without the supervision of.
I know. One of the things that you said that made me reach out to you was when you said to my patients, "Oh, stay on your medication, and we'll talk in the next session." That was like,
I love it. I love
I
it.
like her. Let's talk about something a little bit more fun. You've been working on Skool Kids book series.
Yes.
Tell me about that.
So one of the things with that with my organization Reach that we do is we go out and we do community events, right? So it's so when people are mentally ill and they go missing, sometimes there can be some prevention. So if there was some mental health prevention in the first place, that individual may not have never wandered off and gone missing, right? So when I go out, I'm providing, or my organization, we're providing education about signs and symptoms to look for depression, for anxiety, for schizophrenia, for any type of mental health issue. We do that preventatively. And one of the things that I noticed is I would be at different events and there'd always be these kids around, right? So it's difficult to talk about the topic of going missing when you have kids there. And I remember I was at this event, I was with my mom, and I was like, Mom, I wish we had a book that we could give these kids to talk about, what to do if you go missing or what to do when you're out, and about. And so that evening I went home and I started, just kind of looking to see what books maybe we could purchase to kind of distribute. And it's not that there weren't books out there, because they were, but they were all about animals and, and I wanted something more real. I wanted
relatable.
Real. And so I literally wrote 6 books and did nothing with them. Probably within a month, I just wrote them all. And I don't know. And then I just sat on it because it just felt cathartic to do, right? And then at some point, my mom started pushing me, encouraging me, like, maybe you should try to get these published. And so I did. I did some query letters and all that. And I had some interest, and I won't name the companies. Because one of the things that one of them told me is that they didn't like the character's name. One of the characters' name is Mitrice, who is near and dear to my heart. All of the characters in those books are very near and dear to me because either I work directly with their family. One of them is so I wasn't giving up those names. I wasn't giving up the characters. So they didn't like that 2 of the characters were Black, which is a coincidence. And so they wanted the book, but there were lots of things that they wanted me to change, and I didn't. So I put the book down again, and I left it alone. And then my mother, who passed away about 2 years ago, said to me towards the end of her life, like, you need to do something with those books. So probably I decided to self-publish, which was the best decision that I ever made. So the first book is Amber Goes Missing. And it's just a story of, like, telling why kids should stay together. Why do we walk together? Why do we, make sure that there's safety in numbers types of things. And also in the books that I've read, I wanted more adult involvement in the books so that the adults are the ones who are literally teaching the kids the lesson. So my second book is coming out in a few months. So the first one's already out. The second one's, coming out soon. So that is
awesome.
Yeah.
What's the title of that book that's coming out?
The first book is Amber Goes Missing. The next book is Treese Takes the Bus Alone. And it's about those
nice.
Right? There's a time when kids are going to get on the bus alone. And so in this book, she's going to be taking the bus, and her aunt, who she's going to go see, puts a GPS device in her backpack, and it just kind of talks about how do we stay safe when we're on the bus alone.
Yes, definitely.
That is so cool.
Definitely.
Going back a little bit, because you mentioned a word that made me think of something. Is it and you said you like to read a lot of research. Are we as a society and scientists, are we doing as much research in terms of mental health for children as we are doing for adults? Okay, so I'm going to answer that. That's yes and no. From what I can see, I feel like a lot of the research, although it's emerging, though, so that's what a lot of the research I think that I'm seeing around children is really related to ADHD, mostly,
like maybe autism or cognitive neurodivergence kind of issues. It seems like a lot. But when it comes to like childhood, like severe depression or childhood anxiety, like I don't feel like there's a lot of research focus in that direction. It's almost like we think kids can't be depressed. So when I worked in the hospital, I worked in the adult population and then often in the geriatric population. However, once a month, I had to go work in the children's ward.
Unit.
Be 5-year-olds who, attempted suicide. So it's almost like we want to think that that doesn't exist, and it doesn't. There definitely, imagine if we looked at preventive medicine with regards to mental health, it would definitely start with the youngest of our population. So, so the no part is no, I don't think we're doing that.
Right.
But the yes part is I think it's going to be an emerging field. That's unless there's some executive order that comes in and cancels all research.
Or research, yeah. No, and one of the things I did in a previous life, I worked for an elementary school, and I did have a third grader that had an attempt. So yeah, just as young as 7 or 8, those things actually happen. So he was trying to jump off the building.
And a lot of times with the younger ones, they'll try to jump. You know what? There is a children's ward in mental health facilities for a reason. Because they have
absolutely.
And there definitely needs to be more.
Yeah. And it is heartbreaking as an adult to see those children struggling.
Yeah.
I know in my years of work, I've seen children in those situations. For me, it's heartbreaking. But they still need services.
And they do.
And they need treatment. So I just wish that there was more research for them, especially not, again, trying to limit their options and actually expand them.
One last question, doctor.
Uh-oh.
For someone, no, this is an easy one. For someone who is hesitant about seeking therapy, what can you say to help them feel better about reaching out for help?
I would say this. Listen, we all, in our profession, we all have different personalities. We all have different styles. We all, there are many different types of therapists out there. So if you encounter one therapist, we don't all work the same way.
Right.
So I would say, it's really about shopping around, sitting in front of a person and saying, does this work for me? Is this something that's going to be comfortable for me?
It's like finding a primary care.
Yeah.
Just like a primary care.
Sometimes it doesn't work with one person because whatever reason. Yeah.
If it doesn't work, then go ahead and find someone else. I know not too long ago, I had a new patient, coming to my office, and I think my office manager was gone, so I kind of went out and greeted her myself, and I was like, "Oh, hi, I'm Dr. Hampton," and she burst into tears. So I thought, okay, let me, I'm thinking she must have some really severe depression or something is going on. I got to get her, to the back. So I was like, come on back. I'm going to get you in right away. I'll put the paperwork aside for a second. We'll do the paperwork. Right. Let's get you to calm down. Turns out that she was crying because I was Black. And she was saying, I never, ever, ever thought that I would see a Black therapist. I'd never thought that I would be sitting in front of somebody that looked like me. And so that's what those tears were all about. I mean, So sometimes it's just like, and it was just a connection. She's my girl too. So she was a pleasure to work with. So, I mean, sometimes you never know. And if it wouldn't, but there are other clients who I've seen one time and they haven't come back. So because maybe it just wasn't. I'm a little bossy. I'm a little more casual. If I see you during my lunchtime, something in my mouth. So some people need something different. Some people need a little more formality.
Mama would say, we are not a $20 bill. Not everybody's gonna like us.
Exactly. So, but it's just like find somebody who works for you.
Yeah.
Find where you fit.
Well, I am very proud of my psychiatrist, Dr. Sanford, my girl. Yes, Lord. And I look forward to and when my phone lets me know that in a week, I'm like, ooh, I get to talk to, yay, I get.
I want to say this one thing too, because as you're saying that, it was making me think. I think in mental health, and I don't do this, but I was taught to do this. I think in mental health, we are the only health provider that is expected to have termination sessions for our clients. That is unbelievable.
Oh.
So I'm not saying that I see my patients forever, because I don't. But the way I get sessions is I slowly wind them down.
Right.
And the last session goes like this. Hey, you're doing great. I think you got this. If you ever need me again, give me a call.
Yes.
That
Yes.
the idea of terminating is unbelievable.
Yeah.
I mean, I've had my primary care doctor for like 30 years. Like,
Right.
he better not terminate me. You know, like who would ever think of terminating someone? So, but in our,
Right.
it's like, okay, you're cured, so now you got to go. It's like, no, this is
No.
if I don't see you again for 10 years, it's fine.
We're good.
And there have been clients I haven't seen for 10 years, and I remember with them when they walked in the door, and it's like, hey, in all these years, you know, sometimes they just tune up. So I think we dispense with that termination, and I love how you speak of your doctor, your psychiatrist. This is wonderful to have that type of support alone, you know.
She said, Miss Green, yes. Is this a good time? Always. That's what she said. Always a good time for you, doctor. Yeah.
Before I let you go, if somebody wants to be part of any of your organizations, or I mean, you're in California, so I don't think if anybody wants to be a patient from other places. I don't know how that works, but if anybody wants to see your website or contact you, your TikTok, whatever, where can people reach you?
All of my social media is Dr. Ronda Hampton. So
okay.
I think that my Facebook, my Twitter, my my nonprofit Reach for Mental Health Awareness is just Reach for Mental Health Awareness. So I have our Facebook page and our Instagram and all that is all the same. So
follow her on TikTok. She's super funny. I said follow her on TikTok. She's awesome. That's what I said.
Yeah, because she came to me and said, I saw a doctor and we got to get her.
Talk to her.
She is awesome. That's what
she's real. Yeah. I saw your video and I messaged you that same day and I was like, I know she might not see it, but when you responded, I called her and was like, she did.
Yes.
I was so excited.
And we need this more and more and more. I went to a psychiatrist when I was a child. I was biting my nails really bad, nerves, and anxiety. Really, really bad. And my doctor was an older white man, Dr. Zimmerman. He tried. I think he tried. I hope he tried. But over my life, with counseling, with therapy, with a good support group, and I think I'm, pretty much a good, well-rounded person. Yeah, and thank God for crocheting.
Yeah, that's it. But like we were talking at the beginning, and I think that's something that she and I share, is I like facts. And I think that part of why I wanted to have this conversation is because I wanted good information that was factual, not what I feel or think or dream. I wanted I wanted facts. I wanted a good conversation, because I think the more we educate people on what the facts are on mental health, they can be better themselves. Yes. And I always say this: if you're a believer, I mean, not everybody that is an artist is a believer, but if you are, my favorite thing to say is the healthier we are as individuals, the healthier the body of Christ is. So if we want that body of Christ to function at full capacity, we need to be healed physically, mentally, so that we can go for our purpose. And we are one finger or one eyelash, but we all can function together. The healthier we are, the body it is.
Yes.
If you're not a believer, the same works in a society.
It does.
The healthier you are as an individual, the healthier we'll be as a society, and we can be better in this world to each other.
Right.
So, with that, I am so grateful.
Yes.
Welcome to the Thrive family.
Yes.
Now you are welcome here anytime.
Anytime.
Thank you so much.
So thanks so much for accepting our invitation.
I do want to say I really appreciate the work that you guys are doing, and thank you so much.
Thank you, Doctor. Thank you. Have a great evening.
Thank you.
Thank you for tuning in to another episode of Thrive by the Rising Muse. If you enjoyed this conversation, be sure to subscribe, leave us a review, or share this episode with someone who might need it. Remember, we are at the Rising Muse on all platforms, including our newest platforms, which are Substack, Fanbase, and Blue Sky.
Mhm. Remember, if you know someone or you are having a mental health crisis, dial 911. If you know someone who's having one, dial 911 or take them to the nearest emergency room.
But if it's you who has the situation, dial 988.
Yes.
If you believe you may be in a domestic violence situation and need support, call 800-799-7233 or text 887-888. Make sure you're in a safe space when you're reaching out.
Yes. Take care of yourself and each other, and we'll see you next time on Thrive by the Rising Muse.
And don't forget to thrive. Have a blessed day.
Bye-bye.
Bye-bye.